Good afternoon, everybody. Thank you all so much for joining us for the Council of State Governments 2020 National Conference Reimagined. Thank you all so much for being here for our first week of sessions. It is an honor to have you all. So we're giving folks another moment to get settled in and log into the webinar, and we'll get started here. So my name is Dina Klimkina. I am the program manager of our disability employment policy portfolio. And today's session is the effect of COVID-19 on transition age youth and young adults with disabilities. Individuals with disabilities bring a lot of unique talents, skills, and perspectives to the workplace. And the benefits of including more individuals with disabilities in the workforce are numerous, including higher workforce morale, a more inclusive workplace culture, improved operational performance, productivity, creativity, and profitability, and a reduction in turnover, among a lot of other benefits. And it's really important that we engage youth and young adults with disabilities in the workforce early to help them build the meaningful and fulfilling careers that they desire. States can play a critical role in ensuring these students and young adults are not left behind the pandemic. And today's webinar will showcase how states are working to ensure that the rights and needs of youth and young adults continue to be met during the COVID-19 pandemic, how states are addressing any new or unique challenges that youth with disabilities are facing, and how the center can help. Today, we are co-sponsoring with the Center for Advancing Policy on Employment for Youth, also known as CAPE Youth. And CAPE Youth will premiere its research on state responses to the COVID-19 pandemic as it relates to youth and young adults with disabilities preparing for employment or post-secondary education. I'd like to thank our incredible panel of speakers, our fantastic partners at the Office of Disability Employment Policy, who you will hear from shortly, and the Center for Advancing Policy on Employment for Youth, and their hard work in developing this webinar. Before we get started, I'd like to draw your attention to a few housekeeping items. Next slide, please. So here we have a few Zoom-specific instructions on accessibility. So we do have closed captioning available at the bottom of your screen. You will see a button that says closed captioning. That will be available there. To reduce a noise during the conversation, all participants will also be muted during the webinar. And then we also ask that your camera be turned off at this time if possible, so we can really focus on this amazing speakers and what they have to say. This webinar will also be available to view on our website with the transcript and slides available about a week later, and they'll be available in an accessible PDF format. If you have any questions for our panelists or in general, please submit them through the chat feature in Zoom, and we will be happy to help. If you have any technical difficulties or general questions, please contact CSG registration and we'll get back to you as soon as possible. So without further delay, let's get started with our program. Next slide. It is my absolute honor today to introduce our special guest who will be providing opening remarks. Today we have the U.S. Department of Labor Office of Disability Employment Policy's Deputy Assistant Secretary, Jennifer Sheehy. She helps to advance ODEP's mission of developing policy that increases job opportunities for youth and young adults with disabilities. In 2016, she was appointed by the President to the Ability One Commission. And prior to her current position, she spent 10 years at the U.S. Department of Education in many roles, including Acting Director of the National Institute on Disability and Rehabilitation Research, Acting Deputy Commissioner of the Rehabilitation Services Administration, and Special Assistant to the Assistant Secretary of the Office of Special Education and Rehabilitation Services. She came to the Department of Education from the Presidential Task Force on Employment of Adults with Disabilities, where she was a senior policy analyst and served as a Detail as Associate Director in the White House Domestic Policy Council. And before she joined task force staff, she was the Vice President of the National Organization on Disability and Director of its CEO Council. Thank you so much for joining us today, Deputy Assistant Secretary Sheehy.
Thank you so much, Gina. It's so nice to see you. Thank you for your kind words. Yes, and I always am a little embarrassed when you read all the the jobs. My most important job is the one I have now, and that is helping you guys be successful, because you are incredible partners with us, and we really value that relationship, primarily because it has been so successful and has significantly increased employment opportunities for young adults and adults with disabilities. So we're honored to be here, and congratulations on the 2020 CSG conference. And I know it will be successful as some of your other initiatives. So my office, the Office of Disability Employment Policy, is part of the U.S. Department of Labor. We're non-regulatory. We're a federal agency that promotes policies and coordinates with employers and all levels of government, including state government, to increase workplace success for people with disabilities. As I said, we are great partners with you all. We've been partners for several years in our important State Exchange on Employment and Disability Initiative, or SEED. It's a unique state and federal collaboration that promotes the adoption of disability inclusive policy through an innovative partnership model. And sorry about that. That's one of the lovely benefits of our virtual world right now. But CSG has, in fact, been one of the founding partners in SEED. And over the years, we've developed a long list of events and policy products with you all for state legislators and governors that have demonstrably advanced employment opportunities for job seekers and employees with disabilities. And I can assure you that many of the laws and executive actions that the states that have been involved have adopted and implemented wouldn't have been possible without CSG and SEED. So thank you so much for your leadership in this area. I've been so impressed by the way you all have celebrated the 30th anniversary of the Americans with Disabilities Act, for example. That was last July, with so many different events, social media and webinars and that kind of thing. So thank you. And I want to thank you, Dina, and Elizabeth Whitehouse, and Heather Schaefer, and Christina Gordley, who we've worked with on different initiatives. But today we are talking about an extension of our partnership with CSG through the Center for Advancing Policy for the Employment of Youth, or CAPE Youth. It's a newest initiative with you all, and Cornell is a partner in that, as well as University of Massachusetts. And we're going to hear from our partners today. I also want to thank Kirk Liu and Robert Trombley from my office, my colleagues who will be joining you today too. Before I turn it back to you, I just want to say this is such an important topic, and some of us have not had to think about starting careers for a long time, but I want to kind of tell you something, a quote that I think about when you think about launching careers, because they really are dreams, and you have these dreams as a young person and you hope to follow them. But comedian Mitch Hedberg said this about dreams. He said, "I'm sick of following my dreams. I just want them to tell me where they're going and I will hook up with them later." Because it's hard, it's really hard. But the young people with disabilities that are looking today have partners like you all and experts that you're going to hear from today that are involved in helping them launch those careers and really follow those dreams, so they don't have to do it alone. So thank you in advance for all the work and the fun we're going to have together. And I look forward to the rest of the presentation. Thank you.
Thank you so much, Deputy Assistant Secretary, for your kind words and the remarks. We've absolutely loved working with you and your team at ODEP, and so we're incredibly grateful to you for your leadership and for all of the hard work that your team puts in. So if we can have the slideshow back up, As I've mentioned previously, and thank you, Deputy Assistant Secretary, for also mentioning, today's webinar is hosted by the Center for Advancing Policy on Employment for Youth, also known as CAPE Youth. And we'd like to take a moment to introduce the center as well as our partners. The major goal of our center is to improve employment outcomes for youth and young adults with disabilities by helping states build the capacity in their youth service delivery and workforce systems. Next slide, please. So CAPE Youth is a collaboration between the Department of Labor's Office of Disability Employment Policy, the Council of State Governments, the Yangtan Institute on Employment and Disability at Cornell University, and the Transitions to Adulthood Center for Research at the University of Massachusetts Medical School. CAPE Youth conducts research on new and existing innovative policy and practice approaches to improving transition and employment-related outcomes of youth and young adults with disabilities, develops strategic partnerships between national, state, and local workforce systems, shares best practices among key stakeholders for individuals and families to state legislators, practitioners, and beyond, and helps states identify opportunities to expand career pathways, work-based learning, strategic partnerships, systems coordination, and professional development for those serving youth and young adults. We are available for research requests, technical assistance, and any resources related to youth transition policy within the state. Now, I'd like to hand the reins over and let our partners introduce themselves to you. So up first, we have our fantastic leaders at the Office of Disability Employment Policy, and I'll hand it over to Kirk Liu.
Good afternoon, everyone, and thank you for joining us today. As Jennifer mentioned, our leadership has prioritized the delivery of services and our policy development work around youth and the services for youth and disability and their transition activities. And we are leveraged and placed in a very unique position where we can work with all levels of government. And as a non-regulatory federal agency, we have that flexibility to work with employers, state level policymakers, as well as local areas to really look at increasing those workplace success for people with disabilities. And we're looking to influence that policy and the quality of those employment opportunities for young people with disabilities. As everyone knows, the Workforce Innovation Opportunity Act passed in 2014, and it prioritized the services to youth, especially youth with disabilities. So ODEP, Office of Disability Employment Policy, understood the importance of that and has been understanding the importance of looking at the policy development for youth with disabilities for a long time now. Next slide, please. ODEP does this in a variety of different ways, mainly through our policy development. And a lot of that is done through our relationships and our collaborations with our federal partners, with our states and our local areas, through the demonstration initiatives that we have put out in the past and current, understanding what our federal partners are doing and making sure we're all on the same page, and then providing technical assistance and sharing the effective practices, the great research that we're doing, and understanding what's working in other states and sharing those innovations is part of the technical assistance that's important to ODEP as well. As you guys can see on the slide, there's some information that will lead you to ODEP's website. Please go to the website. We have a variety of different initiatives that relate to states and the work that you're doing around improving the employment outcomes for persons with disabilities. So I'll turn it back to you, Dina. Thank you for having us.
Thank you so much. And I'd like to now introduce one of my other colleagues, Elise Gurney, to introduce our other centers.
Hi, everyone. Thank you so much, Dina. Thank you, Kirk. My name is Elise Gurney. I'm a research associate with the Council of State Governments working on the CAPE Youth Project. And it is my honor to introduce our partners from Cornell University, the K. Lisa Yang and Hock E. Tan Institute on Employment and Disability. So the Yang Tan Institute conducts research and provides continuing education and technical assistance on many aspects impacting the lives of individuals with disabilities. The Institute conducts research which is translated and applied in a real-world context. It focuses on the intersection of people with disabilities in topics such as work, education and learning, the community, health and well-being, data, and other emerging topics. And I would now like to pass it over to our colleagues at the Transition to Adulthood Center for Research at the University of Massachusetts Medical School.
Hi everyone, this is Marcia Ellison from UMass Medical School, Transitions to Adulthood Center for Research. So you may not know UMass Medical School, but we are the Commonwealth of Mass' first and only public medical school and one of the nation's top 50 medical schools. Within the UMass Medical School is the Transitions to Adulthood Center for Research. And our mission is on this slide. We promote the full participation of transition age youth and young adults ages 14 through 30 with serious mental health conditions in socially valued roles. One of our major center grants within Transitions to Adulthood Center for Research is the Learning and Working Center for Transitions to Adulthood. We focus on youth with serious mental health conditions, and we are funded by the National Institute on Disability and Independent Living Rehabilitation Research. So it was very nice to remember Jennifer Sheehy's role in NIDLR in those years. Also within our center at UMass Medical School is a newly funded Center for Knowledge Translation for Employment Research. So we are providing research, training, and technical assistance to move research, NIDLR research, as well as other funded research on employment for people with disabilities into adoption and use. So that's some of the foci of our center. Turn it back to you.
Thank you so much, Marcia. Next slide, please. I'm now going to introduce the Council of State Governments, the third partner of the Cape Youth Center. The Council of State Governments was founded in 1933. It is the nation's only organization serving all three branches of state government. The Council of State Governments is a region-based forum that fosters the exchange of insights and ideas to help state officials shape public policy. We offer unparalleled regional, national, and international opportunities to network, develop leaders, collaborate, and create problem-solving partnerships. All right, next slide, please. We're now going to get started with our program. Today, we're here to discuss the approaches that states have implemented to protect the civil rights and meet the needs of youth with disabilities during COVID-19. I'm honored to present our presenters who will be discussing how states are addressing service delivery challenges and barriers, including around mental health, distance learning, and employment access facing youth with disabilities in the wake of the COVID-19 pandemic. First, we have Glenna Gallo. Since 2017, Glenna has been the Assistant Superintendent of Special Education in the Office of Superintendent of Public Instruction in Washington State, and she is the past president of the National Association of State Directors of Special Education. Prior to that, Glenna spent 7 years as the State Director of Special Education for the Utah State Board of Education, following work as a classroom teacher and administrator. She has over 25 years of public education experience and 15 years of experience in state government. Our second speaker is Secretary Grace Ho. Grace has served under Governor J.B. Pritzker as the Secretary of the Illinois Department of Human Services since March of 2019. The mission of IDHS is strengthening Illinois by building up lives and communities, which is achieved through an integrated network of mental health, substance use prevention and recovery, rehabilitation, developmental disabilities, and family and community services. IDHS operates 7 psychiatric hospitals, 7 developmental centers, 1 treatment and detention facility for sexually violent persons, 76 local offices, and 4 schools. Next, we have Jason Vaden. Jason currently serves as the Deputy Division Director of Program Policy and Support in the Vocational Rehabilitation Division within the Texas Workforce Commission. He has experience with a multitude of state and local government programs, focusing on policy research and analysis, program development, implementation, management, oversight, and evaluation. Also joining us from Texas is Erin Wilder. Erin is the program manager for transition and pre-ETS in Texas. She started as a vocational rehabilitation counselor in 2002 and held multiple transition-related positions before moving to the Texas Workforce Commission Vocational Rehabilitation Division in 2018. With support from many others, her team is responsible for developing policy and training, developing and implementing pre-ETS initiatives across the state, developing resources for counselors, and providing direct support to field staff. Erin also serves on the Constituent Advisory Committee for Texas A&M Center on Disability and Development, the Student Centered Transition Network for Texas, and the Governor's Continuing Advisory Committee for Special Education. And last but certainly not least, we have Sydney Geiger. Sydney is a policy analyst at the Council of State Governments, focusing on barriers to employment for people with disabilities. Sydney has experience in engaging state leaders to discuss policy issues and solutions in a bipartisan and innovative way. Prior to CSG, Sydney worked for the Commonwealth of Kentucky. And with that, I will hand it over to Sydney. Thank you so much.
Thank you so much, Elise. What an honor it is to speak with all these other impressive panelists. I don't know how I got to be so lucky to be with this group, but I'm very honored to be here with all the panelists and excited about jumping into their content. But first, to start off the conversation, we wanted to share a little bit about an initiative that CSG and the Cape Youth Center has been working on since COVID first started, and just really sharing kind of firsthand what states are doing to respond to this unprecedented time. So I'll go ahead and jump in here and then we'll switch over to the panel discussion. But while youth with disabilities are not inherently at a higher risk for contracting COVID-19, youth with disabilities can be disproportionately affected by the disruption of services, including appropriate special education services, accommodations included in their individualized education programs, such as IEP planning and transition services, employment services, and just access to other daily supports and services. So lack of access to regular school days can be particularly challenging for the over 7.1 million public school students with disabilities, as schools provide valuable structure, development, training, and a sense of community. And I'm sure, as you all know, schools across all states have shut down in-person education at some point during 2020. And now we're seeing a mix of hybrid learning, distance learning, blended learning, in-person. And so while some schools are utilizing this, the school next door might be utilizing still online distance learning. So this disruption to the traditional day can limit these services that are required for a youth to have a successful transition after high school, whether that be employment or post-secondary education. And states can look to other states and other school districts to see and think creatively as to how to adapt to this environment and continue providing services. So regardless of that setting, students should still be provided equitable opportunities to pursue post-secondary education and employment as they prepare for their life beyond high school. So during this unprecedented time, state policymakers must look to other states and resources to learn about and create these innovative solutions that we're going to be talking about shortly to address the challenges and obstacles that we've seen due to the COVID-19 pandemic. So our goal as a center is to provide timely, innovative information and solutions to policymakers as states respond to this unprecedented time. In particular, our research will help states understand how they can continue to provide the services they've already been providing and also address the new challenges that COVID-19 has raised for youth with disabilities. So to answer these questions, the center has been conducting a national state-by-state scan on state responses to COVID-19. And our initial scan has identified several major areas on which we're focusing. If we can go on to the next slide, please. So we've had some specific areas of focus that we've seen very common throughout the states, and those include assistive technology, distance learning, family engagement, individualized education programs, mental health, telehealth, and transition services. And we're very honored to have representatives from Illinois, Texas, Washington, all different parts of the country to talk more specifically about what their state is doing. We can go on to the next slide, please. So states across the country are taking various approaches to adapt and ensure that students continue to have access to the educational content and services they need through assistive technology. So states have created a number of resources ranging from applying and replicating traditional accommodations in a remote setting, using free online apps and resources, and just making assistive technology directly available to students. So one example is that Michigan is increasing access to assistive technology to support their online learning through grant-funded initiatives such as their Alt-Shift lending library, where students can actually go on and lend these necessary technologies. And additionally, like I just spoke about, we've seen such a shift to distance learning, blended learning, all these hybrid, all these new terms that before we were not very familiar with. And so this change has given new challenges to parents, to schools, to students, principals, teachers, you name it. But it has particular implications for students with disabilities. And there might be a new need for accommodations, assistive technology, one-on-one teaching, alternative assignments, you name it. There's a lot of flexibility that's needed during this time. And so states have worked really hard to provide administrators, educators, and families with best practices, resources, guides, and strategies for distance learning. And one that we're super excited to hear a little bit more about later is the Washington Office of Superintendent of Public Instruction. And they conducted some least restrictive environment case studies to help schools and educators understand how to provide these environments. And I won't get too far into that because we'll get to hear directly from Assistant Superintendent Gallo here in a little bit. So we can go on to the next slide. Additionally, family advocacy and family engagement plays a key role in helping youth with disabilities transition into adulthood. Over and over again, studies have shown that family support positively affects graduation rates, employment, post-secondary achievement for all youth, but including those with disabilities. And so some states have developed innovative approaches for how to keep families engaged during distance learning and the transition process during COVID-19. So states have built a lot of online resources for families and guides for schools for how to interact with families. I know the state of Washington included information for how to recognize and accommodate the individualized cultural backgrounds, needs, and strengths of families, which was particularly innovative that we haven't seen other states do. It was really, really neat program. And also the North Carolina Department of Public Instruction developed a website completely dedicated to families called Remote Learning Parent and Caretaker Resources. On this, parents can find access to technology help, COVID-19 information and updates, online educational activities, you name it. It's kind of a one-stop shop for parents and family members and caretakers to get on and access that very needed information in this time. Additionally, the pandemic has introduced many constraints, forcing states and schools to think creatively about how to conduct IEP meetings, what to revise within the IEPs, regarding service delivery, how to continue providing these services and the supports, virtually or hybrid, whatever that might be. So adapting to these changes, states have begun offering guidelines for how to host virtual IEP meetings, providing telefacilitation services, providing resources to supplement IEPs to account for any limitations imposed by COVID-19. So Colorado, as well as New Jersey, have been providing IEP telefacilitation services at no cost to schools or families remotely during COVID-19 to help with that process. You can go on to the next slide, please. Additionally, many states are recognizing now more than ever how important mental health services are to students and young adults with disabilities. States are finding innovative ways to continue providing mental health support to students, even when they're not in schools, to help students identify with and cope with these additional effects of the pandemic. I feel like every time I get on, online to look at the news, there's some article about how the pandemic is affecting mental health of the youth and young adults in our society. So happy to see all the responses that states are having to this. And, states have been offering guidance to mental health providers for providing telecounseling, connecting students and parents to direct services, and things of that nature. I know New Jersey and Maine have provided a multilingual helpline for emotional support directly for youth and young adults. And additionally, the Maine Department of Health and Human Services Office of Child and Family Services funds the Family Respite Program, which expanded access to services during this time, which provides 26 hours per month of in-home support to families raising a child with a mental health diagnosis or 2 or more developmental delays. So giving that direct care to youth. And we can go on to the next slide. And then just to wrap up and talk about our 2 last topics here. I'm sure you all have heard the word telehealth a million times this year, it seems. I think everyone has benefited from telehealth this year as a way to enable people to access medical care in a socially distanced way. And this has allowed students with disabilities to access necessary services such as occupational therapy, speech therapy from their homes. And students are able to, get teletherapy, telehealth directly through this. So we've seen, a lot of different state agencies making sure that students are aware of these services. For example, the Wisconsin Department of Public Instruction released teleservice considerations, which provides guidance and resources to school districts to understand how they can continue providing these services to students with disabilities during the time. We've seen a lot of other web pages, online toolkits, and presentations of how schools can continue to provide telehealth services to students throughout this time. And last but definitely not least is transition services. And this is a key focus of the Cape Youth Center. And so states have focused on adjusting, how do we deliver these transition services virtually? And how do we ensure that, even though we might not be in school, these students are still graduating, are still going out into the next steps in the world. So there's been a variety of different ways. They've been offering guidance to educators and service providers, providing resources to parents and families like I talked about earlier so that they can continue transition planning at home. And then, for example, Texas Vocational Rehab, which we'll get to hear from some very impressive speakers from Texas here in just a moment, talking about their online student transition fairs, which is a really great way to make sure these services are still provided. So with that, I will wrap up and just say that all of this information, all of this data we've collected will be up on the Cape Youth website in the upcoming couple of weeks. And so if you're interested on getting a direct link once it's posted, if you just want to put your email in the chat, or if you want, you can send a private message to me with your email, and we'll make sure that once this gets posted, we can send you a link to it so that you can look state by state what your state's doing, or by topic. So it'll be a really interactive way for you to access all of this information that I've talked about today. But I know it's much more exciting to hear from the state leaders themselves. So here in just a second, we're going to put up a quick poll before we get started, and then we will transition over to our panelist speakers. So if we can go ahead and get the first poll question up. It's which topic are you most interested in learning more about as it relates to state adaptations of COVID-19? So all of these topics I've just heard about, I'm interested to hear which ones you're interested in. Looks like we're getting a lot of votes in. Yes, so it looks like we're sharing the results. Looks like the majority of people are interested in hearing about transition services, but looks like we have interest in all topics. Looks like mental health and distance learning are also up there. So very excited to get to talk more in depth about these topics as we transition into speaking with our impressive panelists. So if we can go on to the next slide, please. Great. So we will get to hear now specifically from state leaders and how they've adapted and responded to the rise of COVID-19. So we'd like to welcome back all of our panelists, and just like to say and point out that I'm so impressed by this panel because it shows kind of how different government agencies all have a role in this. You know, we have representation from Department of, Superintendent of Special Education. So Department of Education, we have workforce development and vocational rehabilitation folks. And we also have Department of Human Services. So kind of how, these transition services bleed over into a lot of different agencies. And so we're honored to have such a diverse and impressive panel with us here today. But we're going to start with our presenters from Texas. So we're so honored to have Erin Wilder and Jason Vaden here with us today. And I know I spoke a little bit about and mentioned the Texas providing these online transition fairs for students with disabilities. It seemed like a very quick adaptation that you all realized how important this was. So I was just interested to have you all speak a little bit about the fairs and how you all decided this was a good way to continue providing these services.
Sure. Well, hi, good afternoon. I'm Erin Wilder, and I'm the program manager for transition and pre-employment transition services, otherwise known as PREETS. And so we, in Texas, the Vocational Rehab Division is part of the Texas Workforce Commission. So we are a shared workforce system. We work closely with our boards, and we've been using a platform called Easy Virtual Fair. Out of habit, you may hear me call it EVF. And this was a platform or a sort of a format that we had seen some of our workforce development boards using to get information out to groups of people, to have job fairs and that kind of thing. And when COVID, sort of locked us all down and put us into this virtual world, we started thinking about how we could maybe use that as a means to provide information around transition and PREETS to students with disabilities and their families. And so we started looking at different platforms, and we found Easy Virtual Fair. We liked it because it had some of the features we wanted, but also it was the most accessible. And of course, that's something that's really important to us. We don't want to exclude anybody in these events. So now it's been pretty cool because now, whereas we were attending fairs, the boards were conducting, they're now coming to ours and, sharing information as partners or attending and getting the information themselves. As I mentioned, it's highly customizable. There are a lot of different ways you could use it. You can also change the way it looks pretty easily. And they've assigned a project manager to us who helps us with kind of the tech aspect of that. We've also established point people across the state to be trained on the use of the platform. And they started with a goal of 30 fairs in the first 2 months. And that puts it at about the end of November, and they will meet that goal next week. So the total participation has been around 700 people so far across those events. And we're hoping to increase that number and increase the marketing to our partners so that we can continue to keep that momentum going and also pull more people in to share information and to get this information from the events. Typically, they are framed as either sort of general transition fairs where they're sharing information that pertains to kind of all aspects of transition, or those that are focused on presenting PREETS training and information. And we also have had a few that have been transition employment fairs to help connect students with employers for those work-based learning opportunities. We're also starting to get a little more creative in the way we use it now that we have more people familiar with it. And we're going to be having a mock fair that will be used kind of as a training for our staff so that we can pull more people in and help them get comfortable with it and begin to use it as well. We also, my team has been talking about having our own transition fair for our staff so that they can come and get some face time with us and learn a little bit about what our team does and we also get FaceTime with them. That's something that we have really missed during this time. We have amazing staff and we love interacting with them. So I'm looking forward to seeing some of the other creative things that we come up as we continue with this. The license were initially purchased for a 1-year period, and I think we'll see where COVID takes us, but I also think it's likely that this is something we'll continue to use. It's a good way to get information out to a lot of people at once. Jason, anything you want to add?
Sure. Thank you, Erin, and good afternoon, everybody. It's great to be here with you, and just a special thanks to CSG and all of your partners and everyone else for having us as a part of this panel. It's extremely exciting for us to be able to talk about something that we're extremely proud of and that we've been able to shift to in this COVID environment. I've heard a number of people say over the course of the past couple of months that the first two to 5 months of the pandemic really pushed us forward about 5 years from a technology standpoint. And that's something that we've certainly seen within VR at TWC and then across our agency. It's really been transformative in a number of different ways. So it's been phenomenal for us to have a platform to be able to continue to engage with our students and with our young people. And to Erin's point earlier, to actually see some outcomes, to see those contacts being made, to see students that maybe felt somewhat abandoned, early on within the pandemic, be able to connect and be able to collaborate and have a job in some cases on the other end. That's extremely important, or to be able to explore different opportunities, be it education, training, or actually achieving employment. And not just with a focus on a job. Our mission at the Workforce Commission is all about preparing for and providing individuals with careers, which is much bigger than a job. So it's been really exciting. To Erin's point, it's certainly taken a team to be able to pull this off. It's not easy when you're traditionally used to working with people in person. And so making that shift has taken, not only us, but a number of our partners across the state to be able to pull that off. Erin had mentioned our initial goal of hosting 30 events in 60 days. When you think about it, that's an event every other day. And there's a tremendous amount of planning and preparation that goes into that. It's been awesome as Erin and I have had an opportunity to be able to work with our team, to be able to pull some of these off and just see our staff continue to grow and find new uses of this platform as we continue to engage. And as Erin mentioned, we're extremely excited about what the future holds. The world today looks a lot different than it did 8 or 9 months ago. I don't know that we ever go back to doing business the way that we did it 8 or 9 months ago. This has really been a huge systematic change for us. So I think moving forward, you're going to see us continue to look at alternative options for service delivery, with this platform being one that hopefully we're able to use for some time to come.
Thank you all so much. And Erin, to your point about, having 700 people and still wanting more, I think 700 is a very impressive number. But I love that you all, just want to continue to see that grow. And also, Jason, to your point about, careers versus jobs, I think that's very important. And I was speaking with a youth recently, actually, who was saying, was talking about their high school, was not a youth from Texas, but was saying, I feel like they just want to get us a job a job at McDonald's and not really thinking about where our life is going to go. So I love to hear you say that about, making sure people have careers and not just the job's not the end all be all. So I love hearing that and love, your perspective on how else can we use this platform for, whether it be for staff training, professional development, or, growing it into even post-COVID times and, how you can continue to use this. So I think you'll see other states start to, be interested in how they can utilize it as well. So thank you so much for sharing that. And I wanted to kind of ask you all, since you're our only representation from Voc Rehab on the panel, just kind of how you think that other Voc Rehab offices across the country can ensure this continuation of transition services during this unprecedented time of COVID.
Sure. Well, Sydney, I'll go ahead and jump in first on this one and then turn it over to Erin. One of the things that's I think really important and something that has definitely been front and center over the years is just how important partnership and collaboration is, right? Partnership and collaboration were certainly important before the pandemic hit, but I think now more so than ever. We're very fortunate in Texas that the vocational rehabilitation program is situated within the larger Workforce Commission. That certainly gives us a lot of opportunities to work with our partners within workforce. We've got all four of the core programs under WIOA located in one area, in addition to job training programs for a number of other programs, our unemployment insurance system, and then also the subsidized childcare program in Texas is located with us. And I say all that because that gives us an opportunity on a daily basis to work with all of our partners. Because if you think about it, these programs are also interconnected. I don't know what other states are facing. I know our unemployment numbers across the nation have been huge, but we've had over 3.5 million people who have filed unemployment insurance within Texas since March, and that's a number that does continue to grow some. And with that, we see a lot of unemployed individuals who are also vocational rehabilitation customers. And so it's extremely important to us that we're able to make some of those connections and some of those linkages. As Erin mentioned earlier too, we also have a fantastic network of our workforce development boards across the state that we're able to tap into and help leverage resources and strengths that they have to offer, particularly helping us connect with economic development, with employment organizations, and their relationships with businesses and employers across the state. That's extremely vital for us. When you think about us as a system, we're essentially a pipeline that starts with providing high quality subsidized childcare to young people to put them on the path and to help parents achieve their employment goals. But along that continuum is certainly working with our students and really promoting career awareness and then preparing them for post-secondary education or preparing them for those careers. And for us as a program, trying to do that in a vacuum just within the vocational rehabilitation program is certainly not enough. So having those relationships in place and being able to utilize those connections is important. And while we are, somewhat of an integrated system, that does not mean that we're not working with people outside of our agency. That's extremely important to us as well. So really building and fostering those relationships with secondary and with post-secondary education has really been impactful for us throughout this last 8 or 9 months. And that's something that Erin might want to expand on a little bit later. She has certainly been at the forefront in working with our education partners to help not only continue to build those relationships, but really enhance those as we've shifted for the vast majority of our customers the way that we're doing business right now. But one other thing I would quickly like to highlight too that I think is extremely important that we as an agency feel like is extremely important is messaging and communication and how we're outreaching people. Again, the way that we're providing services is very different than it was 8 or 9 months ago. But that doesn't mean that we've gone away. Just because we're operating a little bit different. We're still here. We're still serving people, and we work very hard to be able to get that message out. Obviously, we're taking the health and safety of our customers and our staff into account with every decision that we make. And we're also working, again, very closely with our education partners because they're a great resource when it comes to referrals into our program. And so with that, Erin, I would turn it over to you if you want to maybe just start and talk about what we're doing with some of our educational partners, and then any other thoughts and observations you have about how VR agencies can be successful in this environment.
Sure. Well, I think the main thing, on the most basic level, it's just been keeping in touch with them and understanding that, they're living through this very unusual time as well and dealing with challenges that don't exist in the world without COVID. So I know that I and my team have had many conversations with our education partners at different levels just to let them know we're still here, we still have services that are available, and here's how you can stay in touch with your VR counselors. And if you're not sure to go where to go, here's who you can contact to get that information. And that's something that has been helpful. We've tried very hard to make the shift from in-person services to virtual be as seamless as possible, and to keep services, and I can primarily speak to pre-eds, but to keep as many services as possible under VR available. There are a few services that, by definition, certain assessments and that kind of thing that happen in a close one-on-one environment. And, obviously we're taking things like that into consideration, and have been for months at this point. I think one of the keys, and this seems like such a no-brainer, but when you consider how big Texas is, it's been a pretty big undertaking. It's just technology and making sure that, if virtual services are available, that everybody has access to the technology they need to be able to tap into them. And of course, that's a big part of keeping pre-eds available to students. We know that in a lot of cases, the schools have provided technology, and that's great. And that works for a lot of students. Many students have technology at home already, but the ones that I think really concern everyone are the ones who don't, or they don't have the support at home to use it. And then we also went into high gear when this first became a real concern, and everybody was, combing through our policy to ensure that we didn't have anything in place that was going to prevent our providers from transitioning to virtual services. Most of our policies up to this point sort of assumed in-person services, and I think that's appropriate in many cases, but I do see where shifting to virtual services has happened pretty seamlessly for many of our providers, and it's opened up some options, especially in rural areas. We struggle with some services to get providers in those areas. And if it's virtual, anybody can participate. So, in addition to being able to serve more students in that way and reach some students we wouldn't otherwise have that particular service available for, we're also, we have students who are in Lubbock who are able to access services that otherwise only occur in Houston and things like that. So, there have been some real benefits to that. And I also think that, as Jason mentioned, this has sort of forced a shift in how we look at technology as it relates to what we do. And I think that, even when COVID and being in contact with other people is no longer as big a concern, we're going to continue to keep some of these things we've learned in mind and use them to make sure that our services are that much more available to students across the state.
Yes, thank you so much. I think you all both made so many great points. I mean, hearing about the interconnectedness with other agencies, I almost just wanted to clip that portion and put it directly on our website, because we talk about that so much, about systems coordination between VR and education and human service, all these different agencies. And I think that that's very true. And then the rural benefit as well. I think, I've heard that from other legislators and state leaders from all over, talking about how now, with all of these online platforms, the access to rural communities. So it's great to hear you mention that as well. I have one last question for you all. And that was, and I think you touched on this a tad, but kind of what obstacles have you faced? It seems like, you all have had such great success, but I'm sure there were obstacles that you faced as you were transitioning to this, delivery of services virtually. And so I'm just interested to hear kind of what obstacles you had and how you overcome them.
Sure. Well, I think one of our biggest challenges, because of kind of the timing of all this, was maintaining some of our bigger summer programs that by design are really meant to occur in person. Our largest summer program is called Summer Earn and Learn, or SEAL, and it's a 5-week summer internship program in partnership with the 28 workforce development boards across the state. And because we're such a large state and there's so much coordination involved that's going on for months before it started, we unfortunately this year had to cancel it. However, I think the positive thing that came out of that was, we immediately started considering the virtual options and, how we could still, be sharing information. And that was ultimately what led us to the Easy Virtual Fair platform and exploring that as an option. And as I mentioned, we, when our staff were first sent home, we quickly went through and identified exceptions and have worked with our providers to make sure that our policies match the work they're actually doing now, so it doesn't create other issues for them later. And that process has gone relatively smoothly. Let's see, staying connected with students has also been a challenge, and that's kind of where the technology piece I mentioned earlier comes in. But we have ensured that our staff have the necessary equipment, of course, and then we've also provided strategies and ideas for remote delivery of pre-eds and other services. We've also shared that with our school partners so that, if they're struggling from their end to sort of connect the dots, we've provided some strategies and some ideas for how to ensure that connection remains, including just encouraging that communication and regular interaction to maintain the referral processes and allow for continued services. I think initially there was kind of almost like if I can't see you working, then you're not working kind of thing, because everybody shifted very quickly into being remote when they were used to working together in person. And they understand at this point that no, just because you don't see us at the school, that's not an indication that we aren't available or that the services have gone away. So we're also looking at some options for reinstating safe in-person services. And of course, we'll consider all of the guidelines that are out there to keep that as safe as possible for everybody involved. But we recognize, and I think it's truly been highlighted during this period, that remote services are not ideal for every individual. And there are a variety of reasons for that, but we recognize that it doesn't make sense to provide services in a format or, a mode of presentation that aren't going to help the person actually gain the skills. So we're considering that as well. And I think, we'll see what happens through the winter, but hopefully, we'll reach a point in the next few months where, we'll be able to have that as a very real option for some services.
Yeah, thanks, Erin. And Sydney, while we appreciate your comment, I'll tell you, I chuckle a little bit because even though there are some things that we figured out, there are new challenges and new issues that seem to come up on a daily basis. Be it with service delivery or technology, or as Erin had mentioned earlier, maybe our policies and procedures, potentially limiting good services from happening. And I would just say that we're very fortunate as an agency, and that our leadership during this time period has really emboldened upon all of our staff, top to bottom, to really take a hard look at the way that we're doing business and to ask ourselves, does this really make sense? And I'll tell you, because we've always done it that way, is never an acceptable response. And so we've had a lot of systematic change, and it's been for the good. It's certainly not easy, but I have seen so much growth and so much creativity in us just with our system during this time period that it's been really exciting. So if I would leave you all with anything, it's to, I think, really take a close look at anything that you have in place right now, again, be it a technology or a policy or procedure that's limiting service delivery, really quality service delivery to the people that need it the most right now. Take a hard look at that and re-examine that and see if change might be needed, and hopefully empower yourself and your teams to be able to lead that type of change.
Great, thank you both so much. I think that was so informative, and I know I can speak on behalf of myself and my colleagues that we really appreciate all of your hard work and continuing to provide these services in this time when it would be so easy to say, nope, we're closed. So we really appreciate that. And thank you so much for speaking with us. And I know we have a couple of questions coming in through the chat. we'll kind of get back to those at the end once we hear our other panelists, and we'll wrap back around. So if you have any questions throughout the time, go ahead and put them in the chat and we will jump back to those at the end. But now we are going to transition over to Assistant Superintendent Gallo. We are so honored to have you here today. And I know I mentioned earlier in my presentation about a project that you were a lead author on and worked on. And so I just want to start off by asking you if you can share a little bit about the Special Reopening Education Guidance, Least Restrictive Environment case studies, and kind of the purpose and the benefits, and just a little bit about that project. It might be some of our audience's first time hearing about it. So.
Great. Thank you so much, Sydney. And thank you for the opportunity to discuss our efforts over the past 9 months. The pandemic provided us with an opportunity to really examine our current system in times of crisis and see what structures functioned as they needed to, which ones failed, and which adaptations were needed. Part of that work was that we started to develop the LRE case studies because we really started to see a pattern being raised by questions from the field, whether it came from district administrators, whether it came to us from teachers or from families. And it gave us an opportunity to look at those questions and look at the coordination between those, as well as our priorities and our strategic plan, which in Washington, we have a strategic plan that focuses on inclusionary practices, really looking at how do we get students with disabilities access to the general education system first, and then supplement that with quality and effective special ed services. And we also identified a need to really improve our post-school outcomes. So we were seeing students with disabilities were struggling with graduation. They weren't necessarily going on to higher ed at the same rates or at increasing rates, and were not always successful in their employment. And so what we did was we were providing guidance on the need to re-implement IEPs in the fall. And it was clear that in the field, there was concern and there was misunderstanding. And what was happening is they were thinking that as they came back into school in the fall, that they would need to amend all of their student IEPs to address a remote setting or a hybrid setting if they weren't able to safely start with in-person services. That was not only erroneous, but it's contrary to the intent of IDEA. And so we had to act rather quickly. This particular guidance document was developed over about a 1-month time period between June and July with stakeholders. Because we needed those stakeholders, both those educational and community leaders, our educators and our families, to really look at what is the guidance going to resolve? What is it going to answer for the field? And what is going to be the most effective? So that's kind of the background of the project. And again, I'm very lucky to work with talented people who really care about students and the needs of students. And we're able to kind of pivot quickly together to create that document. It had kind of 2 purposes. So both kind of a stated purpose and then kind of an additional background purpose. So what we were really clear about with the field is that it was to serve as a companion resource. The state educational agency was developing and releasing ongoing guidance documents that address the needs of all students. And what we wanted to say was those guidance documents also apply for students with disabilities. And here is some additional information. And it really focused on best practices and unique considerations for supporting students with disabilities throughout the reopening process, which includes supporting school staff and supporting families as well. What we didn't really say, but the other purpose that was behind this document was to leverage the uncertainty and the need for rapid change caused by the pandemic into kind of a transformation of our special ed system. So kind of let no crisis go unused, ways to leverage that to make some pretty quick change to the system. It's a short document. You've probably got the link in the chat by now. It's about 22, 25 pages. And we've seen a lot of benefits from it. The main benefits that I've seen is that it really refocused the field. So in the midst of the pandemic, everybody became really concerned about compliance with the law and kind of forgot about the intent of the law. And so this allowed us to really refocus them on looking at individual student needs. We took a case study for a student of varying needs and ages and showed in that document how to implement the IEP, regardless of the methodology that the school was using to provide instruction. And again, as I started off talking about, we were hearing from school teams that they just wanted to make sweeping changes to IEPs based on the fact that they were in a remote setting. And that clearly wasn't allowed under IDEA, nor was it the intent. And so we just had to kind of refocus those actions and thoughts on individual students. It also gave us an opportunity to improve special ed service delivery, to really let them look at what are the expectations that the IEP team should be looking at for student progress and student needs. And then how is it that we make educational decisions, even during a time of scarce resources, safety restrictions, and planning to reopen school facilities? How do we make the decisions that meet all of those requirements and still assist students in making progress? It also helped us really remind IEP teams of the existing need to look at assistive technology. And that's been a requirement in IDEA for several years, but has really gotten lost, I think, in the rapid expansion and the decrease in cost of assistive technology and the ability to use both low tech and high tech opportunities. So it allowed us to really get them to think about what do we need not only during remote instruction, but how can we use this time to put in place some assistive technology that will still serve and benefit the student when they come back to in-person services and then after school that they can use in further education or employment. And then lastly, I think the benefit was that it really helped us clarify reporting requirements for districts, which just luck of the draw here is we were rolling out a new funding system for state special ed funds, and how they look at LRE and placement. There's some incentives built in for increased access to the general ed classroom. So it all kind of ties up into taking us back into that strategic plan and vision and still making sure that we meet the needs of students.
Thank you so much. Yeah, that gives such a great background on the purpose, and kind of hearing you talk about, no crisis going unused, or, I've heard it said silver linings, and hearing you and then also our colleagues from Texas talk about, how can this continue to be of benefit after COVID, or how is it, maybe this is something that would have not gotten addressed had it not been for COVID. So I think that's a great point. And although there's plenty to be negative about this year, it's seeing, like you said, just seeing how it has turned out to benefits and kind of reignited that purpose in us all. So thank you so much for sharing that point too. I think that's very relatable and very true across a lot of work that we have going on in the state. So thank you so much. And I know we've gotten to hear a vocational rehabilitation perspective from our colleagues at Texas, but interested to hear from you in an education perspective, how has your department or office, really adapted to continuing to provide the services under IDEA during the pandemic?
Thank you. Yeah, this was an interesting question, and it really caused me to reflect quite a bit on what changed, because the pace of change was so rapid. I think that there were kind of 6 main points that I've seen adaptations that will continue even after the pandemic ends. The first is it's really allowed us to remember why we went into this field and why we do the work that we do. I don't know if you're familiar at all with the Golden Circle by Simon Sinek, but it allowed us to stop focusing on the things that maybe weren't as meaningful and didn't benefit students, and kind of gave us permission to try new things in a less risky environment. Because so much was unknown, we could try things out and quickly change if it didn't work or increase it if it was effective. And I think that helped, knowing that we were all in it together without one person or agency bearing all the responsibility. And it helped us not only adapt our actions, but really respond to the needs of our team members as we were all personally going through this too. We really took this opportunity, even though I talked about the quick pace of the work, to sit down together with other agencies and develop responses that really incorporated the needs and the requirements of across those agencies to the field. So for example, we were releasing documents that came from the state educational agency that talked about education, also included information about health and safety of students that came from the Department of Health, and then information that talked about the safety needs of school staff that came from labor and industries. That was, I think, key to this work, and is something that we really need to continue, in that it provides one comprehensive document instead of people needing to go to several places to get the information that applies to them. We also really identified and focused on the need for active and authentic family engagement in problem solving and decisions. It became readily apparent that when decisions were made and the needs of families weren't considered and they didn't have an opportunity to provide input, that those plans just were not as successful. And because education needed to rely so much on the assistance and support of family members in a remote environment, we really had to prioritize that and look at how it was that we involved them on the front end. Again, by still moving quickly, but making sure that there was an opportunity to hear their voices. And then the other thing that I'm thinking about under our kind of shared responses is that the need that was coming out in the research and the medical reports about education really needing to focus more on how to provide social emotional learning and mental health supports to students, as well as supports to their workforce. And dealing with, as we were trying to motivate and keep a workforce going while ensuring their safety to make sure that students continued to learn, that was a huge step that really had to be addressed. Along with that, we had to increase the frequency of our communication and look at how we were providing communication. And this one's interesting because I think that a lot of times as state agencies, we look at the fact that we need to provide things in writing, and we often forget about people who are not English speakers or who may not have the literacy skills to read governmental text. And we started to hear from those people who were really pushing for accessibility tools that would allow them to be involved. Doing webinars, making sure that we had closed captioning available, that we had real-time interpreting available. Even though we were asking schools to consider the needs and those communication needs of families, little things would crop up that maybe you wouldn't even think about. Like as teachers were sending instructions home, if the instructions were in English, we had parents that were unable to access those and support their children. And then we also had to live in this environment that was risky. And so we had to develop policy when we didn't know all the parameters. We didn't know exactly what was going to change. And we still had to make a decision and move forward. And I think that making that visible and modeling that at the agency level was helpful to districts and families, because they saw that that we were in the middle of it too, and that we were all focused on how to make sure that their students learned. You know, again, you said it, Sydney, and our colleagues from Texas said it, but this situation provided us with an amazing opportunity that shouldn't be wasted. We need to rebuild the public education system in an equitable manner, and we need to be able to support learning in a variety of ways that meets the needs of all students and leads to those improved post-school outcomes.
Thank you so much. I think that's perfectly said, and all of your points are just so accurate. And I really appreciate you speaking to the mental health perspective as well, as we've seen that, you know, like I was saying earlier, it just keeps making the headlines. And so I'm glad to hear that Washington is prioritizing that and social emotional learning as well. One last question for you, and then we'll switch over to our final panelists. But I was just curious kind of what you've seen from an education perspective as the biggest challenge during COVID-19 and making sure that students are prepared for life beyond high school, whether that be post-secondary education or employment.
Of course. So I've already kind of talked about some of those challenges. One is that we didn't really know what was going to happen with the IEP of the implementation of IDEA. There was talk about Secretary DeVos submitting recommendations of temporary waivers or Congress taking action. We also weren't seeing high rates of use of assistive technology. We knew that districts weren't able to fully implement IEPs in the spring due to health and safety restrictions. But some of the barriers that kind of surprised me and that we're still working to address is that during that initial swell of COVID across Washington, we lost access to our community placements with not only business closures and businesses that have remained closed or went out of businesses. But even now that some businesses are open, the availability of school personnel to provide in-person support due to sickness or safety concerns or health needs, or even collective bargaining agreements of the educator workforce. Transportation, using public transportation and making sure that that's being able to be done safely is also a barrier. One of the ones that we're most concerned about is what do we do for those students who lost valuable time that they needed to spend on transition skills during the spring or summer, which in Washington we were all pretty much under a stay home, stay safe restriction. And how is it that we provide them with an opportunity to regain those skills that were lost prior to their graduation or reaching maximum age? So for example, our students who are at age 20, can only receive services through age 21. And if they have lost 6 months or 10 months or a year of these needed transition services, how is it that we make those up? How do schools offer that, and how is it funded? And what policy and legislative decisions need to be done to do that? And then the last one is just, I think, emphasizes the need that even as much planning that we do together across state agencies, there's just always more in areas that we wouldn't have considered. And an example would be like the Disability Administration Agency, Department of Voc Rehab, Juvenile Justice, and the State Educational Agency. And how is it that we are able to put out kind of a consistent message when our programs are so different? So an example would be differing requirements around telehealth. And one that I hear frequently about here, which is why are some services allowed in person if they're medical, but those same services that are considered educational are not able to be provided in person? So like board certified behavior analysts, speech language pathology, things like that. So, I mean, it's a work in progress. As we identify these barriers, we plan and adapt our work to remove or reduce those barriers. And I'm just going to bring us all back to the whole point of this is around education. And for me, I'm looking at student-specific needs as per their IEP and their post-school outcomes. Thank you for the opportunity to talk about this.
Yes, thank you so much. And thanks for sharing about all the great work that Washington is doing and sharing all of your insights. It's very much appreciated. And I think brings such a dynamic point to our conversation. So I really appreciate it. Next, we are going to shift over to Secretary Grace Ho from Illinois Department of Human Services. We're so honored to have you here with us as well. And I haven't gotten the chance to talk about the opportunity and program that Illinois has put on, but it was something that we found during our research that we found particularly innovative, and we're so excited to have you speak more to it. And that is the COVID-19 Summer Youth Employment Program. And so I think from what I've read online and from a blog that we have partnered with you on in the past, it's that, you know, it's really an opportunity to see this need of employment even during the COVID-19 and kind of adapt to that. So would love to hear a little bit more about the program and the vision and purpose behind it.
Sure. Good afternoon, everyone. It's a pleasure to be here, and thank you, Sydney and CSG for inviting Illinois to the table. You know, one of the things that I think about in terms of not only the project that we initiated for young people in Illinois in the context of COVID-19, but also everything else that we've had to employ, I think similar to probably all of you on the phone, which was when the pandemic hit, we wrote on my whiteboard very succinctly that if it's impossible, that means we have to do it. And I think that it is with that spirit that I hear my co-presenters pursuing their work. And that is with that spirit that we entered into this work as well. And I think one of the other things that I wanted to just express to all of our fellow government public servants is just, you know, gratitude and really commending the work, I think, of government across the board, as we are all essential workers in some way or another. And we have been doing, I think, an incredible job in trying to meet the moment. And I would say in particular, Illinois has really banded together across all the different state agencies that have responsibility for the people of Illinois. So as Sydney mentioned, we launched a COVID-19 youth employment program. But I think even before COVID-19, on a good day, we are proud to host a holistic approach to unsubsidized employment that addresses the physical, emotional, social, and mental health of young people, in particular transition-aged youth from 16 to 24 years old with identified risk areas. You know, the goal is to help them secure full and part-time employment opportunities, provide them with career education and training, as well as pre-employment transition services. And that includes, you know, individualized case management services, including employment support services, educational support services, work readiness, life skills, counseling, career planning, et cetera, et cetera. Well, as many of you know, and I don't have to tell you, COVID-19 had a dramatic impact on the opportunities that were available for young people and, of course, our nonprofit sector. You know, workers in industries such as hotels, restaurants, childcare services, retail, trade, and transportation services were at a higher risk, right? Workers in those industries were at a higher risk of losing their jobs. And nearly half of all workers aged 16 to 24 years old were in fact employed in these service industries. And so young people have been disproportionately impacted by virus-related layoffs. And I think if you add in the racial equity component of that, we know that Black and Brown communities of color have been disproportionately impacted, not only by the virus, but also by the economic impacts and the job losses related to COVID-19. And in Illinois and in the Department of Human Services, we very forthrightly have an equity lens to our work, a racial justice lens to our work. And so that is how we approach the interventions across the board related to COVID-19. And so the Summer Youth Employment Program invested $9 million to hard-hit communities across the state, reaching approximately 2,800 young adults statewide through 30 community providers across the state. And it stretched from June to September of 2020. And while I shared with you at the beginning, during pre-COVID times, we had unsubsidized job opportunities. We made the decision to create subsidized job opportunities during COVID-19 for reasons that I think you could probably understand. So of those 2,800 young people that were in this program, about half and half identified as female, half identified as male. The largest cohort, according to age, was 41% were aged 18 to 20 years old. 20% of the 2,800 were 21 to 24 years old, and almost 40% were 16 and 17-year-olds. Going back to the matter related to an equity, a racial equity frame, of the 2,800 young people, 75% were Black youth. That was the overwhelming majority of the young people who were served, followed by Black, African American, Hispanic, multiracial, white Hispanic, and then the smallest were white, non-Hispanic, and other categories. I think the other important piece to note are kind of the risk factors, right? Which there are about a dozen, including youth with no work experience, youth living in a single parent household, youth who have an IEP, youth experiencing academic difficulties, youth who live in a household receiving SNAP. And of the young people who we serve, the average number of youth identified 3 or more risk factors. And so it was important to us to reach out to those who needed our services the most. And I would say, you know, while we're talking about our COVID-19 youth program in particular, that is the approach that we took with probably all of our interventions here in Illinois related to COVID-19.
Thank you. Sorry, it took me a second to get unmuted. I really appreciate hearing about that and hearing about how you all prioritize diversity and the risk factors that you all talk about. One thing that I was very impressed by was the program components. And so I know there were a variety of different components that were required for this summer program. And I was curious if you wouldn't mind sharing them with our audience today, just because I think it made a really well-rounded and impressive program.
Well, so I think that the most significant component, and I don't know if you would call this a component, is just the need for the program to be flexible. You know, when we initiated the program, we reached out to existing providers, and then we also reached out to providers who were not normally, who didn't have an existing contract. And because of different flexibilities, we were able to reach those community organizations, and we prioritized doing that because we wanted to make sure that every part of the state in those most impacted areas were reached. And so flexibility is definitely one key program component. But I think, you know, as I shared, with the other components that already exist in our employment programs, employment support, educational support, work readiness, skills development, life skills, counseling, career planning. We also had this program that was subsidized, and it allowed young people, right, the opportunity to earn wages while also learning important job skills along the way. And I think what was also interesting, which was kind of a double benefit, is that many of our community-based organizations, or some of them, I would say, were also intergovernmental partners. So we had park districts who participated in the program, and as we all know, revenue to government has been greatly impacted by COVID-19, and us being able to provide some support to the park district in particular in Rockford enabled them to not only power their work, but also provided opportunities for young people to have a job and to learn important job skills. I think that the other components have to do with case management and support. as I named, there are a lot of complicated risk factors that young people unfortunately are challenged with. A good number of the young people who were served in the program were also pregnant and parenting teens. And so because we were a human services organization and not only an employment type organization, there were other wraparound services and supports that young people were able to receive as a result of their participation.
Thank you so much. And I love hearing about the connecting activities and surrounding supports like you're talking about, and how important those are just to employment in general. And we talk about that a lot in our work as well. So I think you bring up a very good point. And, I think it goes without saying that Illinois is not the only state where we're seeing unemployment and youth, looking for opportunities during this pandemic to get that work-based learning like you were talking about. So if other states were interested in developing a similar program as Illinois', which is so comprehensive and so impressive, what advice would you give to other states who are interested in pursuing this kind of opportunity?
Well, I mean, I would say that, as I said at the beginning, that let data drive where your investments will be made. I think all of us are challenged right now as governmental entities with revenue shortfalls and with the CURES funding expiring at the end of this calendar year. I suspect many of us are trying to figure out what's going to happen in January and are hopeful for some federal relief. So I think understanding that financial resources are strained, it's important to really identify where you're going to make the most impact. And so, we made the decision to make sure that those who were most impacted by the impact of COVID-19 were where we need to make the investment. So let data guide your decision making. I think the second piece of it is that we relied very heavily also on our network of community-based providers across the state. That one of the other priorities of our administration was to make sure that our human services system continued to be intact during COVID-19. And so similar to the federal program, the PPP program, the state of Illinois, the Department of Human Services, we made the decision to continue to pay human service providers retention payments during the apex of the first surge. Even though they were closing doors, their services were greatly diminished, we continued to make payments to them as long as they could demonstrate that they were continuing to pay their staff. So I think you can't add on a program to an organization that is eroded at its foundation. And so I think that it's very important to invest in the base infrastructure of the organization, and that gives them the capacity to do even more. And I think the other advice that I would give very humbly is where I started in the program components, which is flexibility. There's no one size fits all to the way that we have our providers have risen to the challenge of this program. I mentioned to you the work that the Rockford Park District has done with this program, a very strong intergovernmental program, right? So they employed 100 youth who engaged in park maintenance, community recreation, customer service. And I have actually the opportunity to meet some of those young people and to hear how this was an important part of their career trajectory. And then we have another partner, the Jewish Child and Family Services, who partnered with Menards, Jiffy Lube, Jewel Osco, FedEx, Target, AMC Theaters, et cetera, right, to build private and public relationships. So, these two different models came from the same program because we allowed the flexibility and innovation to happen at the very front or at the very grassroots level of the program.
Great, thank you so much. And I'm glad you had the opportunity to talk to some youth from the program, because it's always so beneficial to hear, kind of and see all the hard work pay off. And I just want to thank you so much for sharing about this program. And we just shared a link in the chat to a blog that CSG wrote about the program. And we actually link there to the website where you can learn more. So thank you so much. I think now we're going to shift into audience questions. And so we'll have all of our speakers come back, and we'll dive into those. So if you have any more questions, please feel free to add them in the chat. One question that I saw, I think it was originally for the Texas folks, but I think it can be applicable to all of our speakers, is have you done any customer service surveys with the youth and how they feel about service delivery during COVID?
Sorry, I'm having some technical difficulties. We have not, but our staff do keep in close contact with the students they're working with. So we still receive a lot of feedback, and you know, it has been mixed. That's one of the ways that we know for sure that virtual services don't work for everybody. And we already sort of knew that conceptually, but I think having that feedback has certainly confirmed it, and you know, caused us to have more conversations and more thought about how we can kind of bridge that gap. And Jason and I were kind of chatting about it, and you know, I think you know, that's something that we actually may look into doing, because we both like the idea. It would give us a broader range of feedback for sure.
Absolutely. It's great to hear that your staff is still having that, you know, communication and contact with youth, even if they're not able to meet in person.
Sure. Especially if they really, really like something or really, really don't like something, we usually know it.
Right. Absolutely. That's kind of how I feel about reviews online too.
Sure.
People are most willing to talk whether they love it or hate it, not if they're in the middle.
Yes.
Absolutely. Well, another question that we had was kind of what, and this is for everyone, what are the potential consequences if states, you know, don't fill these gaps of transition services during this period? What kind of impacts can this have on states?
I know we have a pretty big potential consequence in VR, because our performance is tied to our funding. And when you know, I think probably like a lot of programs, when you don't spend the funds, you have to return them. And that's an indication that your performance isn't where it's supposed to be. So, you know, and there haven't been any flexibilities put in place for COVID. You know, I think it's possible that that could still happen, but we're operating as if it's not going to, because you know, we know that there's a great need for services right now, and we want to be able to provide them in this way. And like I mentioned earlier, I think there have been a lot of really positive things that have come out of it as well. Just like any hard thing, you know, we're learning from it and taking away some pieces and some ideas that will carry forward regardless of where we are with the pandemic.
And Erin, if I could add one thing, sorry, Secretary, you can feel free to go ahead.
Please go ahead. Thanks.
Okay, I was just going to flag just a, you know, a larger systematic issue that, you know, will certainly have a huge impact on our country. You know, we really can't have a generation of students, of young people that go, you know, for 6 months or a year or years in some cases without gaining, you know, that necessary secondary or post-secondary education or gaining that valuable work experience that's going to benefit them for the remainder of their professional career and really the remainder of their lifetime. So I think that's where it's really just so impactful that state agencies step in along with other partners in developing some alternative programming to ensure that we can continue to deliver high quality services to folks in this environment.
I absolutely agree with that. I mean, I think it's an existential issue. And I think as it pertains to Illinois and our Department of Human Services, is that if you don't address it at this point in the continuum, you're going to see it right downstream, where the interventions are going to be much costly and much, I think it's going to be more challenging to write the path forward. And so, you know, as a human services system, we touch 1 in 3 people in Illinois in some way through SNAP, Medicaid, food stamps, after school programs, you know, the employment programs that we talk about, people with developmental disabilities, mental health. And so we can't say, well, we're not going to do it, so it's somebody else's problem. It actually is our problem as well. And I think the other issue that I would add is that it will only exacerbate existing inequities, right? And so after the summer, we actually started a distance learning program to provide supports for young people who were only able, or school districts were only offering virtual learning environments. Well, do they have laptops? Do they have Wi-Fi, right? And so you know, the educational gap will only increase for those individuals if there's not some sort of intervention that is made. And we are not perfect, and we are not hitting every area that we need to, but we recognize that if we don't help young people at this stage, we're going to be meeting them as adults in a different setting that will be much more difficult and costly to address.
Yes, I agree. And I would just like to add, in education, we've always kind of waited for the pendulum to swing before we've made any changes. And there's been kind of a wait and see approach. And I think that COVID has shown that we can't do that, right? We've always known it was a bad idea, but now we truly can't wait to make changes until COVID is over. We have to move now. And so I think it just kind of heightens the need for us to plan quickly and put things in place and really innovate instead of trying to be like, how do we go back to our previous system, which wasn't effective for all students. So I just encourage people to kind of think about that differently and look at what it is, what can we learn and what can we do differently from here on out. So sorry, I can get a little passionate about this part.
Never apologize for being passionate. I love that. And it seems like everyone here today is very passionate. And I think Secretary Ho said earlier, you know, we have a huge thanks to give to public servants during COVID-19. And I couldn't echo that enough. And another question that we got, and I know Superintendent Gal would be interested to hear your perspective on this because you touched on it slightly earlier, is how can states best engage parents and families and caretakers to assist with transition services during this time?
You know, I think really setting up ways for people to communicate and collaborate. And we're so used to needing to be in the same room or driving somewhere to have a conversation that we need to figure out a way to bring in experts and to bring in families and to look at it from like a holistic approach. So what are the students' needs? And then what are all of the various resources that could be available to that student to address those needs? I think that, again, it's an opportunity to change the way that we've done things. And I love Texas's idea of these virtual transition fairs, because I think what a great way to really provide an opportunity to access information that you may not have accessed before. I know that I'm much more likely to hop on a Zoom and join a meeting to get information when I know that it's not going to require me to drive somewhere. But then how is it that we're also making sure that our meetings and these opportunities are accessible to all? And so especially when we're talking about students with significant disabilities, you know, whether it's sensory, whether it's developmental, we need to really plan around those and make sure that we can engage with those students. One of the things the disability community shares with me frequently is don't make decisions about us without us. And I think that's such a concept that we really need to remember, because I'm not going to consider all of the needs, the individual needs of each person that's involved. But we can start by setting up the system so that they can be engaged.
Thank you so much. Did anyone else have anything to add about how to engage parents and families during this time?
Well, I would say that we do it in a couple ways. I mean, I think, as I mentioned, we're also the front door for SNAP, Medicaid, and TANF in Illinois. And during the April and May months, we actually moved everything virtual within a matter of months. And so we've actually begun to open up some of those offices with, now that we have PPE and plexiglass installed. We're watching the numbers very carefully. We still have a lot of virtual services available, but we also have offices available. So family members, individuals can actually walk into our offices and ask questions and seek support. We serve families in a variety of different situations and settings. And so, I think what we try to do, and this is an aspiration of ours, is to really have an integrated human services system. So regardless of what door you come into, you can access the array of programs. And I think, in this condensed leadership structure that we have under COVID, we actually are, I think, a more tight unit, a tighter human services system, but there's, I think, a long way to go there. We've actively reached out to family members with loved ones in our hospitals or in our developmental centers to make sure that they have timely and accurate information. So we actually invested a lot more in communications than we ever had before, and marketing. I had to kind of reframe my own sense of like, well, PR and marketing is actually a luxury, but actually it's not, because if people don't know about the services that are available to them, you're actually shutting the door to them to services. So we actually invested in a really more robust way to reach out to folks during COVID-19.
Yeah, and I would agree with the statements from the other panelists. I think y'all have done a great job at addressing this question. And to me, it really comes down to being flexible and really meeting people at where they're at. And I don't just mean that in a physical nature, but just where people are at their station in life right now. Just knowing that so much has changed over the course of this year for so many people. For us, and I'm sure others are in the same position, where your secondary or your post-secondary schools are probably a mix of students that are there on campus, students that are learning remotely, maybe some all the way remotely and some on campus. But that means for us that our transition coordinators aren't out there on campuses right now, in all cases, engaging with students and engaging with counselors and their parents. So just figuring out ways to be flexible and continuing to be able to interact and engage with people, taking into account all circumstances, is certainly important.
Thank you so much. And thank you again to all of you for contributing to this conversation. It's so great to hear directly from the states and to just see the passion of our public servants from across the country. I'm going to shift it back over to Elise to close us out here in just a moment, unless anyone has any last words that they would like to say before we pass it back over.
I would just say hang in there and keep up the good work. And if there's anything that I can do, if you ever find yourself in Illinois, please look me up. And thank you to Jason, Erin, and Glenna as well for sharing all that you're doing.
Sure. Same message from us in Texas. Thank you all for everything that you're doing. And if we can ever be of assistance, please feel free to reach out directly to Erin and myself. We're certainly here to help and share any information and best practices. And a big thanks to our panelists. This was really a great conversation today. And thank you, Sydney and team, for having us.
I would like to echo that. I've really appreciated the opportunity to talk about this today, to reflect on our practices and what we still need to improve, and then to hear what other states are doing is always helpful. I've been communicating back and forth with my team about what are we doing with transition planning, and are we doing statewide webinars with DVR? Are we only looking at regional? So it's been an incredible opportunity to learn as well as to reflect. Thank you.
Thank you all again so much. It's been such an honor to talk with you all today, and I will pass it back over to my colleague Elise.
Thank you, Sydney. I'd just like to convey our appreciation for everyone who participated. Thank you to Deputy Assistant Secretary Sheehy, Assistant Superintendent Gallo, Secretary Ho, Jason Vaden, and Erin Wilder for your time and for sharing your insights, which I'm sure have provided policymakers and leaders in this field with great ideas to take home to their states and communities. Thank you also to all of our attendees. If you have any questions or if you would like to connect further, please contact the Cape Youth Center, myself, or Dina Klimkina. Once again, if you have any questions or would like further information, please don't hesitate to reach out. We also ask that each of you take a few moments following this webinar to fill out the survey that you will receive by email. You will be able to indicate whether you will need CRC credits for this session, and you will be provided with information on joining our listserv to learn more about upcoming projects and publications. We also hope that you will join us for our upcoming conference programming. You can see these on this slide. On November 19th, we have a session entitled Ensuring a Disability Perspective in State Policy. Following that, on December 11th, we have Disability Employment Etiquette. On December 16th, Inclusive Legislatures, Courts, and Cabinets. And finally, on December 17th, Telework Adapting to the COVID-19 Economy. And all of those sessions will be held from 2 to 4 p.m. Eastern Time, just like today's session. Next slide, please. If you are interested in any additional information or research, please see our CSG COVID information and resources web pages, which, as Sydney mentioned, will be up in the next few weeks. For those of you who sent us your emails, we will make sure to alert you when those pages are up. And if you did not have an opportunity to do so, but would like to, please either direct message us or put your email in the chat, and we'll be sure to include you in that. This slide also contains links to disability-specific work on COVID-19. We encourage you to read our resources or reach out to CSG or Cape Youth if you have any other questions. CSG has a robust portfolio of work on disability employment policy, and we are happy to provide technical assistance, research, and any sample legislation you may need. Also, please be sure to follow us on social media. Next slide. Our federal partners also have several resources available on COVID-19 featured here. This includes resources from the Job Accommodation Network, the Equal Employment Opportunity Commission, and the Administration for Community Living, among others. Next slide. Finally, CSG would like to thank our partners and sponsors for supporting this year's National Conference Reimagined. That concludes today's webinar. Thank you everyone once again, and we hope to see you soon.